My name is Kelly Nelson-Sikos, and I work for Allina Health Forensic Nursing Program. I've been an emergency room nurse for 26 years and a forensic nurse for 6. A forensic nurse is a registered nurse who has gone through special training to become a forensic nurse and care for forensic patients. So as that nurse, we specialize in the care of patients who have experienced trauma through either a sexual assault or an intimate partner violence, domestic violence, those types of situations. And we are there for you as a patient to take care of all of your needs. Taking photography of injuries if needed, a narrative of what happened. If you choose to, collect evidence for the use by police, and take care of medical needs, talk about needs to prevent sexually transmitted diseases, pregnancy prevention, HIV, hepatitis B, and really make sure all of your medical needs are taken care of. And then arranging follow-up care for the next several weeks, months, up to a year to make sure that medically and emotionally you're doing well along the way. If you've been sexually assaulted, all you need to do is present to the emergency room, any emergency room that's in your area, and you will be provided forensic nursing services. But we will respond 24 hours a day, 365 days, we're always on call. Everything that you tell me is completely confidential. I don't share information with the parents or police or anybody who asks questions without your consent or your permission. So sexual assault exams are actually paid for by the county in which they occur. Along with that charge being paid for by the county, there may be medications that we may give you or pregnancy prevention medications we may give you, and that's actually paid for by the emergency room in which you're being seen. So you should not receive any bill for the sexual assault exam. This exam is completely your decision. You are the person that will consent to this exam. Your parents and nobody else can make you have a forensic exam. I can share information with your parents. I can talk to your parents about the decision that you're choosing to make, but the ultimate decision that is made is on you. The greatest resource that we offer patients is advocacy. So we have a few options. We actually will call the advocate group from the hospital, and patient can talk to advocacy on the phone. They can actually stay on the phone during the exam if they'd like to have somebody else in the room for emotional support. And we've just started tele-advocacy, which is a small iPad that we are able to essentially Skype in an advocate and talk to the patient and have actually face-to-face communication with somebody. And then in addition to that, we fill out what's called a release of information, which you, the patient, would sign, and it gets sent to SVC or the advocate group, whichever one responds to that hospital, and they will call you and follow up with you the next day. We know that both males and females are sexually assaulted. We see more females than we see males, but it's important that regardless of being a male or a female, that you know that there should be no shame or no embarrassment. We believe you. We want to hear your story. We want to assess you. We want to make sure medically you're taken care of. And you should not be embarrassed about what you're going to share with us. We will listen to you, and we will hear you, and we will take care of you. We believe you.